Hey guys, it's Hilary with Backcountry Pulse, and we're going to talk a little bit about helicopter operations and rescue. So this is an area I'm particularly passionate about because I work full-time as a flight nurse here in Northern Colorado, and I think there's a lot of things that people need to know about how they can help contribute to orchestrate a really successful rescue. So we're going to cover a few things in this video. First one is choosing an appropriate landing zone. The second one's what is an appropriate patient for air rescue, and then the third being what can you do as the provider calling to make sure that the rescue goes well from both sides. So first thing we'll talk about is what kind of patient are you calling a helicopter for? There's a pretty generally accepted list of conditions and assessment findings that we think necessitate a helicopter rescue out of the backcountry. First of all, being GCS or Glasgow Coma Score less than 10, so altered mental status, any kind of penetrating trauma injury to the head, neck, or chest or abdomen, spinal injuries where paralysis is a concern, there's alteration in sensation or movement, anyone unresponsive, any head injury, amputations can be partial or complete, 2 or more long bone fractures, so long bones don't include hands and feet bones, and any kind of crush injury to head, chest, or abdomen, a burn over 15% of your body's surface area, a tourniquet in place, or a drowning or near drowning, or a buried party in an avalanche. So that's kind of a generally accepted trauma list, the generally accepted medical list necessitating helicopter rescue, chest pain or concern for a heart attack or myocardial infarction, anaphylaxis, shock, respiratory distress, or any kind of neurological concern as if someone is having a stroke. So those would all be better served with an expedient rescue to definitive medical care. Obviously, that's one consideration is a patient's condition. The other consideration is your location. If it's a really long ingress or egress, difficult conditions to get in or out, or local resources are exhausted by their current situation. So if it's a somewhat mass casualty type situation with multiple patients and the local area only has the ability to care for a couple patients and there's more than that, a helicopter would be brought in to remove patients to definitive care. So those are some reasons that you would want to launch a helicopter. Next is kind of the process for how it works. So you start the whole process rolling by either calling 911 to get the local area dispatchers, or you use your local GPS device that you can hit a button on that sends out a distress signal. So either way, local area dispatch is contacted for your county, and those dispatchers have the ability to launch a helicopter. The things that they're going to want to know are a little bit about a patient, so if you can ballpark age and weight, and then just some background information on what happened that the patient needs helicopter rescue for. Next, they'll want to know your coordinates or the best information you can give about your location. So GPS coordinates are preferable, but if you're on a road and your GPS isn't working, you find mile markers, if you can give a trailhead and how far you are down a trail, any kind of objective information about where you're at that will help pinpoint your location. Next, they'll want to know, is anyone else on scene? So do you have local EMS there? Are there first responders, or are you even with the patient? Did you see an avalanche and you know someone's buried, but you're not even with the patient? So just background information on that and if there's anyone on scene. If there is someone on scene, it helps with radio communications because local fire agencies will be able to be in touch with the helicopter. If not, that's okay too. They can land without any kind of communication. Next, they'll want to know if you have anywhere that's an appropriate landing zone. So we'll talk a lot about how to judge what an appropriate landing zone is. I would say don't worry about getting it perfect because that's part of the helicopter crew's job is to circle overhead and find an appropriate spot. But if you happen to have one, it certainly makes it a lot easier. So we'll go through the acronym that we teach all of our local agencies for how to choose a landing zone, and it's HOTSAW, so HOTSAW. The H stands for hazards, So some things are hazardous to helicopters. Power lines, trees, anything, if there's a lot of debris blowing through the air, sometimes any kind of big cliffside, hazardous. O stands for obstacles. So is there a big dumpster in the middle of the way? Or is there a huge boulder or a pile of wood, some kind of obstacle in the area that you're trying to land them? The T stands for terrain. So helicopters can land in a variety of terrains. Obviously, packed dirt or flat ground is the preferred, but snow is appropriate, grass is appropriate, anything that is firm enough to support the helicopter, and flat enough that it can land the skids on the ground. S stands for slope angle. This one's really important, and I think a lot of people aren't great judges of slope angle. So if you're a skier, you are, and you might have a slope angle app on your phone, but 10 degrees is the limiting factor for landing. So any kind of hillside, it must be really, really mild, a really gentle slope, otherwise they won't be able to land there. The A stands for animals, and animals includes humans. You don't want deer running around or dogs or any kind of animal running around underneath where the helicopter will land. The loud noise and the wind obviously agitates animals, and so they become unpredictable. The W stands for wind or weather. Preferably wind less than 40 knots is the best landing condition for a helicopter. So if you're having massive gusts where things are blowing off trees, you're in some kind of storm, that's probably not a condition a helicopter can land in. Otherwise, weather, every company has weather minimums that they have to have a good enough weather report to be able to even take off from where they launch from. So most local agencies have at least 1,000-foot ceiling during the day for the clouds. So at least 1,000 feet off the ground needs to be clear. And then a visibility of 3 miles. So 3 miles from where you're standing looking out. If you're unable to see that, if there's low-lying fog or blizzard conditions, then you can guarantee a helicopter won't be able to launch in those conditions. Helicopters aren't like airplanes where they can turn on GPS and fly through clouds. They have to be able to see exactly where they're going. So if they're unable to do that, they won't be able to even take off. Next, after you have an appropriate landing zone, you need to make sure that it's the right size. So it needs to be at least 50 feet by 50 feet, preferably 100 feet by 100 feet. So this is a big clearing. You kind of can pace out and try to measure by your paces to make sure it's large enough to land the whole aircraft. A couple other considerations about calling a helicopter. Recognize that no one gets charged for a helicopter to lift, even to land at a patient and assess the patient. So helicopters can land, assess a patient, and decide that they'll be safe to go by ground evacuation, and then they'll fly off, and it's no harm, no foul. So it's a great way to get really skilled providers to your area to make sure that a patient is safe. And if they're not safe, then obviously they can transport and evacuate the quickest way possible. So in summary with helicopter operations, understand what is an appropriate patient to launch a helicopter for, what might be asked of you as the person on the ground, and that you have a role to play in choosing an appropriate landing zone to facilitate a fast and expeditious evacuation of a patient. Also understand what's happening behind the scenes you may not see that goes into that whole process working together as a team.